Administrator Slavitt recently announced the creation of a Rural Health Council.
Yes.
Whose job it will be to review all regulations the agency promulgates for their impact on rural providers. I know that you haven't had time to get up to speed on all the details, but I'd appreciate any more information you could provide the committee after this hearing. I'm very much interested in how you see this new effort functioning. The distinguished Senator Franken is the co-chairman of the Rural Health Care Caucus. I need to know, or we would like to know, how this new council will coordinate with or utilize the work already done by the HHS Rural Health Task Force and the HHS National Advisory Committee on Rural Health and Human Services. We've got a lot of folks interested, but there may be some duplication, and I hope we can pull that together.
With regard to the council that Acting Administrator Slavitt has pulled together, I think is in response to topics that we have discussed in this committee. I think you know my personal interest in rural issues. And so any regulation that was coming through to CMS to me, there were a series of questions about rural America that I would ask every time. And I think what we are now doing is formalizing a process by which those analytics that I think are important for us to understand, because I believe rural markets and sometimes urban markets in our country are different. And as we consider our rulemaking, we need to consider both. And so it is formalizing a process that we had been doing informally over the past year in terms of that rulemaking. But we'll be happy to work. I think you hear that it is an issue of interest. We'd like to work with the Congress in making sure we're considering the right things as we ask these questions about impact on rural America.
I appreciate that. Thank you very much, Senator Cantwell.